Welcome to The Explainer. Today, we're diving into a treatment that honestly has a pretty intense-sounding name, shockwave therapy. You hear about it for those injuries that just refuse to heal. But is it real science or just, well, noise? Let's find out.
Okay, let's just start with something I think a lot of us can relate to. You know that injury? The one that just won't go away? You've rested it, you've stretched it, you've done everything right, but that nagging pain in your heel or your elbow or shoulder, it's just there. It's so frustrating. And that's exactly where a treatment like this even enters the conversation. All right, so what are we actually talking about here? The official fancy name is extracorporeal shock wave therapy, or ESWT for short. Now, the most important thing to get right off the bat is that it's non-invasive. We're not talking about surgery. Instead, it uses these really high-energy sound waves to zero in on those injured spots and hopefully kickstart your body's own healing crew.
And this is probably the biggest thing we need to clear up right here, right now. That name, Shockwave. It sounds like they're going to hook you up to a car battery, right? No, this has absolutely nothing to do with electric shocks. Zero. Think of it more like a super-focused, powerful sound pulse. It's all about acoustics, not electricity.
Okay, so sound waves. How on earth can sound actually heal an injury? I mean, it sounds a little out there, doesn't it? Well, the science behind it is pretty cool, and it's all about giving your body's natural repair process a much-needed reboot from the inside out.
I love this analogy because it makes it so easy to understand. Imagine your chronic injury is like a snow globe. But instead of beautiful, fluffy snow, all that gunk inside, the scar tissue, the inflammation, it's all clumped together and stuck at the bottom. What shockwave therapy does is it basically gives that globe a few really powerful shakes. It's designed to break all those clumps apart and get things moving freely again.
And this shaking process really works in three main ways. First, it cranks up the blood flow to that area, which is huge, because that brings in more oxygen and all the good stuff your tissues need to heal. Second, just like with the snow globe, it physically starts to break down all that tough, stubborn tissue. We're talking scar tissue, adhesions, even tiny calcium deposits. And third, it actually helps to calm down those irritated nerves that are screaming pain. It sort of changes how they fire, turning down the volume on those pain signals.
And here's where we can kind of peek behind the curtain and see the really cool science behind these simple terms. When we say it boosts blood flow, a clinician would call that neovascularization, which literally means making new blood vessels. Calming pain nerves? That's neuromodulation. And the whole amazing process of a physical sound wave creating a biological healing response, the technical term for that is mechotransduction. It's really sophisticated science, but the goal is super simple. Get a healing process that's completely stalled out, moving again. All right, so we get what it is and the basic idea of how it works. But where do you actually use this thing? What specific injuries is it for? Let's look at the target list.
So the therapy really has a clear greatest hits list. It seems to shine when it comes to those chronic tendon problems. You know, the ones that are notoriously stubborn. Things like plantar fasciitis, that awful heel pain, tennis elbow, that nagging pain in your rotator cuff or hip. These are all conditions where healing is often stalled because of poor blood flow and a buildup of scar tissue, which, as we just learned, makes them pretty much perfect candidates for this kind of treatment.
But what's really exciting is that we're seeing this technology branch out. Researchers are now looking beyond just tendons. They're exploring if it can help with nerve-related problems like peripheral neuropathy, or even complex issues like chronic pelvic pain or bone fractures that just won't heal. Now, a lot of this is still experimental, the evidence is just starting to come in, but it definitely points to a really promising future for shockwave.
Okay, now for the most important part of this whole explainer. The claims sound awesome, the mechanism sounds plausible, but what does the actual research say? Does it really work? Let's do a little evidence check.
And the good news is, for its main uses, the support is pretty solid. A big review from 2024, which is great because it's so recent, looked at a ton of different studies on tendon problems, and their conclusion, they found that ESWT can be a highly effective option for relieving pain. I mean, that's a pretty strong endorsement from the scientific community.
But, and this is a really big but, the science is nuanced. It's not a simple yes or no. The evidence is way stronger for certain types of injuries. For example, calcific tendinopathy, that's when you have actual hardened calcium deposits in the tendon. For those, it works really well. But for other issues, like general Achilles pain without those deposits, the evidence is a lot more mixed, sometimes even called inconclusive. So, the nitty-gritty details of your specific injury really matter.
And it's also crucial to remember that it might not be the best option in every single case.
Let's take a look at this 2025 study on plantar fasciitis. They compared shockwave therapy to another treatment called platelet-rich plasma, or PRP. That's where they use your own concentrated blood platelets to heal an area. And the results? They were pretty clear. While shockwave definitely helped, no question about it, the PRP treatment actually led to even better pain reduction in this head-to-head comparison.
Okay, so we've looked at the how, the what for, and the mixed bag of evidence. So where does that leave us? What's the real bottom line here? Let's pull all this together into a few key takeaways.
So here's the most important way to think about this. Shockwave therapy is like a reset button. It is not a magic bullet. It's this low-risk, non-invasive tool that can be amazing for restarting a healing process that has just completely given up. But, and this is key, pressing that button is only step one. Real, lasting success almost always depends on what you do after.
And this quote from the research really just says it all perfectly. It should not be thought of as a magic fix. The therapy's effectiveness is so often tied to what you do alongside it. The sound waves can come in and break up the logjam, but you're the one who has to actually rebuild the strength and function in that area with the right exercises and rehab.
So that's our deep dive into shockwave therapy. It's a really fascinating piece of technology, a way to hit that healing reset button without going under the knife. But the evidence is pretty clear. This is not a cure-all. It's a specialized tool for specific, stubborn, chronic problems. So the question we're left with, for both patients and doctors, isn't really, does it work anymore? The real question is, who does it work for? And when is it the best choice? And that, well, that's a story the science is still writing.